organophosphorus compound or organophosphate are commonly used in the industrial, agriculture and home settings. They were initially developed as insecticide, but some of them as nerve gases. Sarin, colorless, odorless liquid used as chemical weapon to its extreme potency as nerve agent. So, a nerve agent used as chemical weapon. Datura, clear colorless, tasteless liquid with faint fruity odor, act as nerve agent and reacts as nerve agent, earlier used as pesticide and later as weapon. These are used as chemical warfare and in terrorist attack. Some organophosphorus compounds are used as pesticide in agriculture. These are highly toxic and include tetraethyl pyrophosphate and terrathione. Other organophosphates such as contrast, chlorpyrifos and trichlorophon are used as animal insecticide and have intermediate toxicity. Low toxicity compounds are malathion, diazinon and dichlorobos. These are used as household insecticide. Organophosphorus compounds are easily accessible and are often used to commit suicides. Accidental poisoning may also occur, especially when they are kept within the reach of children. Farmers could get exposed while spraying crops if they are not well protected with masks, another protective gloves, clothing.
वो बोला था गोला लगने लगा
गुलमाल लगा
कहाँ तो लग गोला लग दिया तुमने
Now let's see the definition of organophosphate poison. Organophosphate poisons are a group of potent nerve agents functioning by inhibiting the enzyme chlorine esterase. Organophosphorus poisoning occur after the respiratory or oral exposure to either organophosphorus pesticide. Examples: chlorpyrifos, dimethoate, malathion, parathion, or nerve agents. Example: Datura, sarin, causing inhibition of acetylcholine esterase at nerve synapses. Now see the clinical manifestation of organophosphate poisoning. Depends on the route of entry, that is ingestion, inhalation and eye contact. Depends upon whether the poisoning is mild, moderate or severe. The symptoms are basically those of excessive acetylcholine activity. Mild symptoms include small or pimple pupil, nausea, painful blurred vision, mild muscle weakness, runny nose and eye, localized muscle, excessive saliva, twitching, eyes looking glassy, fixed mild agitation, state and eye, wide eye, headache. Moderate symptoms include pinpoint pupils, conjunctival injection, dizziness, disorientation, coughing, wheezing, sneezing, breathing difficulty, muscle twitching or tremors, muscle weakness, fatigue, vomiting, diarrhea and urination. The severe symptoms may include pinpoint pupils, confusion, agitation, convulsions, copious excessive secretions, cardiac arrhythmias, collapse, respiratory depression or respiratory arrest, and ultimately can lead to coma and death.
Pathophysiology. The nervous system is made up of a large number of nerves. When signal reaches the end of the nerve, it releases substance called neurotransmitter that carry signals to the adjacent nerve or organ such as the muscles or glands. Many nerves release acetylcholine as a neurotransmitter. Once the signal passes the next nerve, enzyme called cholinesterase destroy the acetylcholine. Organophosphorus compound block the enzyme, thus preventing the breakdown of acetylcholine. The acetylcholine acts as a especially long time symptoms twitches and increased secretion. After some time, the muscle gets fatigued leading to paralysis. Diagnostic evaluation. History collection, physical examination, random blood sugar, blood urease nitrogen, electrolytes, Growth hormone time, liver function studies, and plasma cholesterol measurement. Other laboratory findings include the following: leukocytosis, hemoconcentration, metabolic or respiratory acidosis, hyperglycemia, hypokalemia, hypomagnesemia.
Management. In case of emergency, be ready with these items. Oropharyngeal airway use. It helps to prevent the obstruction of airway by atomic ambu ventilation and ED2. It helps ambu ventilation. It helps in providing positive pressure while breathing, and ED2 it also supports breathing. Gastric lavage. It helps in emptying the stomach. Activated charcoal. It prevents the absorption of poison from intestine while absorbing the poison. Treatment. Termination of further exposure to the poisoning. Face hair. Wash the skin and mucous membrane with soap and water. Gastric lavage according to the need. Maintain patent airway, positive pressure respiration if it is falling. Supporting measures can be maintain BP, hydration, control of convulsions with user diaphragm. Specific antidotes for epitasm, atropine. It is highly effective in counteracting the muscle symptoms, but it is not effective for rheumatic symptoms.
बताइए कैसा है
To recognize the central effect, the higher dose of atropine is required. All cases of anticholinergics like carbamazepine, food poisoning must be promptly given. Dosage is 2 mg IV repeated every 10 minutes till trimesopmal or other signs of atropine deficiency appears like dilation of pupil. Up to 200 mg has been administered in a day. Continued treatment with maintenance doses may be required for 1 to 2 days. This is mechanism of action of atropine. It acts as an antagonist to muscarinic receptor and block its action. Cholinesterase reactivation enzymes used to restore neuromuscular transmission only in case of acute anticholinesterase poisoning. The phosphorylated cholinesterase react very slowly, not at all with water. However, if more reactive, hydroxyl group in the form of enzyme are provided. Reactivation occurs when a ligand acts faster. Pralidoxime has a positively charged catalyzed nitrogen attached to the anionic site of the enzyme, which remains unoccupied in the presence of organophosphate inhibitor. Its enzyme and react with the phosphorus atom attached to the esteric site. The enzyme phosphorus so formed diffuses away, leaving the reactivated cholinesterase. This is mechanism of action of enzymes. First of all, enzymes bind OP compounds are bound to acidotic site with the help of their phosphorus atom. First of all, enzymes bind to the anionic site and then they bind to phosphorus atom of OP compound. Later, enzyme phosphorus compound is bound and they diffuses away, leaving the cholinesterase enzyme. Pralidoxime is injected IV slowly in a dose of 1 to 2 grams. In children, it is 20 to 40 milligram per kg. Another regimen is 30 mg per kg IV loading dose, followed by 8 to 10 mg per kg per hour continuous infusion till recovery. Pralidoxime causes more marked reactive skeletal muscle cholinesterase than an autonomic site and not apparent for CNS. Treatment should be started as early as possible within hours before the phosphorylated enzymes has undergone aging, that is removal of alkali groups, and become resistant to hydrolysis. Doses may be repeated according to need. Maximum dosage 12 grams in first 24 hours. Lower doses according to symptoms are continued till 1 to 2 weeks. The use of enzyme in epitasm is secondary to that of atropine. Moreover, the clinical benefit of enzyme therapy is highly variable, depending upon the compound involved, because different active compounds have different aging rates. strawberry and nuts, but they generate the polynesterosine, that is pyruvexin and orbitazole. Diazepam is used to control seizures caused due to poisoning. Chronic opioid poisoning. Repeated exposure to certain fluorine-containing and triaryl organophosphate or organophosphate results in polyneuritis and demyelination. After later period of days to weeks, sensory disturbance occur, first followed by muscle weakness, then tenderness and depressed verbal reflexes, that is lower motor neuron paralysis. In the second phase, spasticity and upper motor neuron paralysis gradually. Recovery may take years. The mechanism of this toxicity is not known, but it is not due to any reason of polynextiness. There is no specific treatment. Next topic is Datura poisoning. Key points: introduction, mechanism of action, sign and symptoms, toxicity, fatal and lethal dose, treatment and post-mortem appearance, and medical legal aspects. First, introduction. Datura is a genus of 9 species of poisonous Vespertine flowering plants belonging to the family Solanaceae of kingdom Plantae. The leaves are alternate with a lobed or toothed margin. The flowers are erect and spreading trumpet shaped. Colors vary from white to yellow, pink and pale purple. The fruit is a spiny capsule giving the name thorn apple to the plant, splitting open when ripe to release the numerous seeds. An average size fruit contains 450 to 500 seeds and weighs 8 grams. Synonyms: Devil trumpets, moonflower, Jimson weed, devil's weed, hailspace and thorn apple. Traditionally used for skin disorder, ear pain, cough, asthma, arthritis, antispasmodics, and is adjunctive with some drugs, that is cannabis to boost its effect. There are two varieties of Datura. First, Datura alba, Safed Datura, and second Datura nigra, Kala Datura. Active principles: all parts of the plants are toxic, but fruits and seeds are raw, and Datura has a long history of use for causing delirious states and death. Active principles are neohyoscyamine, hyoscine or scopolamine, trace of atropine. The all act mainly on CNS, each having its own individual actions.
Mechanism of action. The alkaloids of Datura interact with and inhibit all muscarinic receptor in the body, which lead to blockage of action of neurotransmitter SES and muscarinic receptor, and hence block parasympathetic system. High dose may also block nicotinic receptor and autonomic immune and enact. The sign and symptoms. The alkaloids of Datura stimulate higher center of brain and then motor center. They inhibit secretion of sweat and saliva, dilated the cutaneous blood vessels, dilated the pupils, and stimulate heat regulating center. CNS effects. The initial stimulation is followed by the depression and paralysis of vital center in medulla. The mind is affected first and is subjected to auditory and visual hallucination. He is appeared to glimpse and imaginary objects, peaks and clouds, and tries to pull imaginary threads from tips of finger. Signs and symptoms can be described as dry as bone, second, blind as bat, third, hot as hair, fourth, mad as better, fifth, red as spit. Dry and hot skin, dilated pupils, dilated vessel, twisted face, dermatitis, diaphasia, diplopia, and elucidation. Fetal doses and fetal period. Fetal doses 100 to 125 seeds. The lethal dose for alcohol is about 60 mg for adult and 4 mg for children. Fetal period death usually occur within 24 hours.
Now look at the treatment. Decontamination, that is promote potassium permanganate, organic acid and phosphates. Physical antidote, that is physocycline 1 to milligram and it is repeated at interval of 1 to 2 hours if necessary. Or neostigmine 2 to 5 milligram and intravenous every 3 hours. Moistening of tongue and changing the size of pupils guides towards the good prognosis. In non-fatal cases, recovery takes a day or two. The effect on pupil being lead to the disappearance. Now look at the postmortem appearances. Findings are dose of asphyxia. Datura seeds may be found in the stomach. Congestion of GI. Datura seeds release putrefaction. Medical importance. For crime that is robbery, kidnapping and rape, children can easily be kidnapped by giving them candy or toffee mixed with Datura. Accidental cases occurs when children and adults eat the raw food or seeds mistaking them for edible fruits or capsicum seeds. Homicide, suicide, abortificate. Now play question time to get a better understanding of this topic. The rule are, first I will ask the question, then whoever knows the answer can raise their hand and tell the answer. Ultimately I will tell the answer if nobody can raise their hand. First question is, what is organophosphates and how do they cause poisoning? Okay, fine. Then look at the answer. Organophosphates are chemically commonly used as insecticides, herbicides, and herbicides. They cause poisoning by inhibiting the enzyme acetylcholinesterase, which is essential for breaking down acetylcholine, a neurotransmitter. This leads to accumulation of acetylcholine, resulting in overstimulation of muscle, glands, and central nervous system. Now, second question is, what is the treatment of OP poisoning? How can someone be exposed to organophosphates? Let's look at the answer. First, by inhalation, ingestion, or by contact, either by means of skin or eye contact. Now, question number 3. What is the treatment of OP poisoning? Anyone can start. Anjali?
Atropine and palidoxin.
That's right. Let's look at the answer at B. Treatment includes decontamination, removing the patient from the source of exposure, and washing the skin thoroughly. Medications, atropine used to block the effects of excessively acetylcholine. Palidoxin reactivates acetylcholinesterase if administered early. Supportive care, assisted ventilation for respiratory failure, and monitoring for seizures. Now let's look at the fourth question. What is the antidote of OP poisoning? That's right. Answer is atropine. Question number 5. What are the clinical features of OP poisoning? Anjali, can you tell? Surabhi, you can answer.
Pinpoint pupil, breathing difficulties, weakness, sweating.
That's right. Answer is pinpoint pupil, increased secretion, diarrhea, urination, proper constipation, bradycardia, hypotension. For further assistance, I would like to call Shreya.
So, the sixth question is, what can be the other cause of pinpoint pupil? Can anybody know? Anyone? Anisma, you want to say something? Anyone? Okay. Good. One answer. Anything else? Correct. That's correct. So, let's see the answers. Opioid poisoning, poison hemorrhage, and phenol poisoning. So, my next question would be, what is atropinization and its most reliable sign? Please stand up and say.
Most reliable sign is increased respiratory secretion.
Okay.
Atropinization, pinpoint pupil, and constipation,
Thank you. Signs of organization. So let's see the answer. So, atropinization, it is a medical term used to describe the therapeutic process of administering atropine in a patient suffering from OP poisoning. And its most reliable sign is decrease in secretion, that is mainly salivation and bronchial secretion. So, next question is, what are the active principles alkaloid of Datura? Anyone from the girl side this time? Anyone?
Atropine scopolamine.
Correct. So let's see the answer. That is, number 1 is atropine, then scopolamine and hyoscyamine. Now next question is, what is the fatal dose and fatal period of Datura? Stand say. Answer, anyone say? Or anyone else? Anyone else? Stand.
Fatal dose is 100 to 200 seeds.
125 seeds, okay. And
Fatal period is around.
that's correct. Let's see the answer. Fatal dose is 100 to 125 seeds and fatal period death can be occurred within 24 hours. So, next question is, give any 2 signs and symptoms of Datura poisoning. Any 2. Not this time, Vanjana. Anyone else? Anyone else from the backside? From the girl side, anyone want to say? Rashmi? Okay, so let's see.
Dilated pupils,
Okay. One more.
decreased salivation.
That's true. So let's see the answer. Number 1 is dilated pupil, decreasing salivation. Other could be hallucination, tachycardia, dry, flushed and warm skin due to reduced sweating. So, next question is, what is the antidote of Datura poisoning? Okay, everyone knows it. So let's see the answer. All were correct. Physostigmate. It is a reversible cholinesterase inhibitor. It increases the acetylcholine level in the synapse, counteracting with the anticholinergic effect of Datura alkaloid like atropine, scopolamine, and hyoscyamine. So my last question would be, what are the risks associated with using physostigmate for Datura poisoning? We use physostigmate, but what would be the risk? Kritika, you want to say? Okay, that's correct. Let's see the answer. It's bradycardia. For bradycardia, we may require a close monitoring and it could be seizure if used inappropriately or in high dose. For MCQs, I would like to ask Shriyansh.
Now let's look at some MCQ. Organophosphates binds to, first question, the options are anionic site of anticholinesterase, acidic sites of cholinesterase, acetylcholine or none. Atropine is useful in OP poisoning because A. Reactivates acetylcholinesterase, B. Competes with acetylcholine release, C. Binds with both nicotinic and muscarinic acetylcholine receptor, D. Is a competitive antagonist of acetylcholine. I'll repeat the options of the second question, which are reactivates acetylcholinesterase, B. Competes with acetylcholine release, C. Binds with both nicotine and muscarinic acetylcholine receptor, D. Is a competitive antagonist of acetylcholine. Answer is it's a competitive antagonist of acetylcholine. Question number 3. A patient presents to an emergency with pinpoint pupil, salivation, lacrimation, tremors, and tears. Plasma cholinesterase level was 30% of normal. Most probable diagnosis is A. OPP poisoning, B. Datura poisoning,
C. Opioid poisoning, and D. Point blank hemorrhage. The answer is correct. Question number 4. Organophosphate acts by inhibiting the enzyme acetylcholinesterase. Which type of enzyme inhibitor are they? A. Competitive and reversible. B. Non-competitive and irreversible. C. Uncompetitive and reversible. D. Competitive and irreversible. D is the correct option. Question number 5. Which of the following is not a symptom of Datura poisoning? A. Dry mouth. B. Meiosis. C. Delirium. And D. Hyperthermia. D is the correct option. What is the role of activated alcohol in management of Datura poisoning? A. It is an antidote. B. It can bind to ingested toxins and reduce absorption. C. It enhances elimination of toxin. D. It is not effective in Datura poisoning. Yes, C is the correct option. It can bind to the ingested toxins and reduce absorption. Seventh and the last MCQ is patient presents with flushed skin, hyperthermia, dry mouth, delirium after ingesting seeds of a plant. Which of the following is the most likely diagnosis? A. Opioid overdose. B. Cholinergic crisis. C. Datura poisoning. And C. Opioid poisoning. Yeah, Datura poisoning is the correct. We are at the end of the MCQ.
इस साइड आ जा और पॉइंटर दे दो मुझे। उसको छोड़ के इधर आ जा। स्टार्ट करो फिर से, तुम्हारा वापस चला। क्या है palm? What is palm? What is the full form of palm? PAM। तो palm लिखे क्यों फिर पैराडॉक्सी में? तो palm क्यों लिखे हो? palm, what is palm? कौन है भाई इधर? palm कौन बताएगा? palm, palm क्या है? स्लाइड बना दिए। 2-pyridine, एल्डोक्सिम, मिथाइल क्लोराइड और आयोडाइड। जब बना रहा स्लाइड तो पता होना चाहिए। तुम्हारे बहुत सारे स्पेलिंग्स भी गलत है। ये हैंग हो रहा है और लेट मी एंड। ठीक है, एंड करने दो फिर मैं बताता हूँ। फर्स्ट स्लाइड ही कर दो एक बार, फिर से स्टार्ट कर दो।